Ladies and gentlemen, as usual, my name is Dr. Chain Akano. So I would admonish us to bring our pen and paper, and so that you can jot down any new thing you're learning today. And then at the end of the exercise, I shall endeavor to answer your questions. So, excuse me. The topic of today, like we all know, is the very, very notorious and common disease, which is referred to as typhoid fever or typhoid. So there are a lot of stories, there are a lot of myths. A lot of people are told they've got typhoid and they are treated over and over, and they still have typhoid. They have everything. They got cough. They said you're typhoid. Do they actually have typhoid fever? It is possible, but we'll talk about it now to see what to do and have a better understanding of what typhoid fever means. So we will start by defining or explaining what typhoid fever is for starters. So there's a broad group of bacterial infections known as enteric fever. This enteric fever comprises of typhoid fever and paratyphoid fever. Both of them constitute what we call enteric fever. So they are caused by bacteria. They are a very contagious multi-systemic infections caused by the typhoid fever is caused by the gram-negative bacteria known as Salmonella typhi, while the paratyphoid fever is caused by another strain of Salmonella known as Salmonella paratyphi A, B, or C. So there are two types of enteric fever. Paratyphoid is similar to typhoid, but it's milder. So we're going to focus more on typhoid, which is the main illness, which is causing a lot of problem in the tropics, in India, in so many poor communities. So we need to talk about it. So first, typhoid is a bacterial infection caused by Salmonella typhi. It's a gram-negative bacteria, and is, when we say enteric fever, it means that these infections actually are gut infection, G-U-T, gut as in intestine. So they actually attack the intestines, so to speak. So they are gut infections, and very contagious, and could be very serious, and could be life-threatening. So this is what typhoid fever is. Typhoid fever can occur in anybody, in a child. It's actually commoner in children, though it's milder in them. It can happen in men and in women. So it's very common, especially in places where there's poor sanitation, poverty, and poor sanitation habits. So this is what typhoid fever is. So the next thing to talk about is, how do you get typhoid fever? How do you contract that infection? Like I said before, typhoid fever is a very contagious infection. The mode of transmission is what we would describe as fecal-oral. Fecal is feces, oral is mouth. So it's like from feces, your stool, to your poo, to your mouth. So it means that basically it's due to contamination of your food, your drinks, by contaminated or infected poo or your urine. So if somebody who's got typhoid fever goes to toilet and didn't wash their hands and touch your food or your drink and contaminate it with that poo or their urine, you will catch the infection typhoid fever. So it's basically contracted through poo contaminating your food or drinks. There is also a sexual slant to it, which I'm going to talk about later. It is possible to contract typhoid fever through oral or anal sex. So it is not just through contamination of your food or drink. You can also, but not vaginal, anal or oral. So this is how you contract typhoid fever. So what it means is that, for example, if you went to poo and after pooing you didn't wash your hands, or after weeing you didn't wash your hands, and you touch food or drink of another person, and if you do have typhoid fever, or if you're harboring that infection, you will contaminate that person's food or drink, and if they eat or drink it, they will catch typhoid fever. Or if you went to the toilet, for example, and that toilet had been used by somebody who had typhoid fever, and the toilet is contaminated by the bacteria, and you touch the toilet and touch your mouth before you wash your hand, you can catch typhoid fever. If, for example, you eat seafood that was brought from a contaminated river or sea, where there was typhoid fever in that water, you can also catch typhoid fever from that. You can also catch typhoid fever from eating vegetables that were, groomed in a poor sanitation. So you can also catch typhoid fever from that. So basically, it is an infection you catch through poor sanitation and through contamination of your food and your drink by an infected poo or urine, especially your poo, lesser extent your urine. So you're not going to catch typhoid fever from the air. It's not like coronavirus you can get from the air. It's not like you can't get it from droplets or aerosols or something. It has to be through your mouth from contaminated food or drinks. So that is how typhoid fever is contracted. So for you to prevent typhoid fever, you will need to be on top of your game with your sanitation. When you go to the toilet, you wash your hands with soap before you touch your mouth or before you touch any food or anybody's food. You make sure that any food that is contaminated or is prone to contamination, you don't consume it. You keep your hygiene, flush your toilets, don't touch your mouth before you flush your toilet, things like that. And don't eat, obviously, contaminated seafood. Obviously, you may not know whether the seafood is contaminated, but you can get it from there. So these are the means you can contact typhoid. And I mentioned the sexual slant. I will talk about the sexual slant, which is not very common, but it's possible. So it can be a sexually transmitted disease, even though it is not what it is basically, but you can contract it from. So we've defined typhoid, what it is, what kind of infection it is. We've talked about how you can contract typhoid. So before we talk about the symptoms and all that, and diagnosis, let's talk about, does it have prevention? Is there any way to prevent you from having typhoid? Yes. Apart from good hygiene, where you wash your hands after using the toilet and avoiding all those things and eating healthily and all that, typhoid has got vaccination. You can have typhoid vaccination. And there are two types of typhoid vaccination that are available. We have the tablet or the capsules, which you can take as orally through your mouth. It's like 3 capsules you take today and take the next day. Then you also have a one-off injection. You can also use one-off injection. So either of them is effective, the injection or the capsules. They would prevent some of them, they could, give you that immunity for even up to 7 years of taking them. But with injection, you may have to take a booster after 2 or 3 years, and with the capsules, you may have to take it again as a booster, maybe after 4 or 5 years. But they can give you immunity against typhoid fever for 7 years. For people like us who live in the advanced world, when you're traveling to places like sub-Saharan Africa, some parts of India, we are advised to take the vaccination before traveling, so they help to prevent typhoid fever. So there are vaccines, the same way you have vaccination for tuberculosis and all that, measles, diphtheria, pertussis. That's the same way you have vaccination for typhoid. It does exist, at least as far back as when I was in Nigeria nearly 20 years ago, the vaccination was there. But you have to get the vaccination from the right and appropriate place so that you don't use a vaccination that is not effective. So usually a live bacteria that you are injected, and then you get the immunity. So that's the way to prevent typhoid fever, apart from your sanitary habits and making sure you wash your hands and all that after going to the toilet, and not touching food and all that after using the toilet and things like that. So that is how you can prevent typhoid. So the next thing we're going to talk about are, what are the symptoms? What are the way you would present? What are these, things you will be complaining about if you do have typhoid? To be clear, typhoid does not have symptoms peculiar to it. So most of the symptoms of typhoid are also the same symptoms: malaria, maybe hepatitis, sometimes pneumonia. So it is not specific. It's not specific. But there are some cardinal symptoms that if you do have them, you can suspect that you may have typhoid fever, and then you would want to investigate and find out whether you do have typhoid fever. Normally, typhoid could be mild or severe. Some people have it and it's a mild illness. Some people have it and it's a severe illness that could kill them. But the earlier the diagnosis, the better for you. The earlier it is diagnosed, the better for you, and the better the prognosis, the better the outlook. So what are the symptoms of typhoid fever that are peculiar? Not peculiar, that are common with it. 1, high temperature fever, as high as 39 degrees to 40 degrees, headache, aches and pain, constipation, cough. These are the cardinal symptoms you may have. And you can see that these symptoms, you can have the same in malaria, you can have the same in pneumonia. So how do you know it's typhoid then? So anyway, if it's not diagnosed at this stage, it may get worse, and usually gets worse. And when it gets worse, you may have symptoms like nausea, persistent vomiting, loss of appetite. You may become confused. You may become delirious, that you are like, you may start even seeing things that are not there. You may even end up, instead of having constipation, you may have diarrhea. You may be so tired, you may have abdominal pain. You may develop rash, a kind of rash we call red rose spots, usually on your chest and lower abdomen. It is clearer on the skin of light-skinned people. So these are some of the symptoms you may develop. And then if it progresses, you may develop more severe symptoms, which may include things like bleeding in your intestine. You may develop bleeding. So when you start bleeding, which may be serious, but is treatable. So when you're bleeding, you may have symptoms like you become tired, more tired, you become pale, you may vomit blood, Your poo may become dark or like tar, coal tar. Your poo will just change color. Your abdominal pain may get worse. When you have this problem, then you must be admitted in hospital because obviously you will need infusion, you may need blood, and you may need surgery, operation to close that bleeding, where it's bleeding from. So intestinal bleeding is one of the symptoms or complication if things get worse. You may also develop a very life-threatening condition. Due to perforation, your intestine will just burst. If your intestine bursts, then that bacteria you have, those typhoid bacteria, will be released in the lining of your intestines, which we call, the lining of your abdomen, which we call peritoneum. This peritoneum is normally a sterile environment. No infection is there at all. So when your tummy bursts, your intestine bursts, and your bacteria are released into this peritoneum, you will develop a condition, a very serious condition called peritonitis. Very serious condition where you become very unwell, the abdominal pain may be worse. In fact, it's life-threatening that if nothing is done urgently, you may develop sepsis. Sepsis is a blood infection, and that infection may go to your organs, your liver, your spleen, your kidney, and all these organs may fail. Multi-organ failure, all these organs may fail, and obviously could die. So many people will develop something like pneumonia, from this typhoid. You can develop what we call encephalitis, which is kind of it's like meningitis, with headaches and vomiting and confusion and all that. You may even develop a psychiatric illness that will last for a long time from this typhoid. You may develop problems in your gallbladder, develop problems in your bone, in your joints. Do you understand? So it is a very serious condition. So depending on the stage of your illness, so it may be mild, that you may just have fever, headache, cough, joint pains, constipation, or you may have things like persistent vomiting, diarrhea, loss of appetite, chest pain, even infection in your heart, to infection in your brain, to infection in your bone, infection in your gallbladder, peritonitis, intestinal obstruction. All this can kill. They can lead to death. So that is why typhoid could be very serious. It could be very serious. Like I said, the earlier you're diagnosed and treated, the better. The earlier you're diagnosed and treated, the better. So that will bring us to, how do you diagnose typhoid apart from these symptoms? You are not the doctor, you are the patient. So you go and complain to the doctor, doctor, I've got headache, the headache is not stopping, I'm taking paracetamol, I'm taking whatever, ibuprofen, headache is not stopping, I'm constipated, I am, I'm having aches and pains, I'm coughing and all that. The doctor naturally, because you live in Nigeria or in the tropics, must suspect malaria, suspect typhoid. So that doctor would want to find out what is wrong with you. And the way to go is investigations, laboratory investigations. This is where the issue is. The main way of diagnosing typhoid, the only confirmed way of diagnosing typhoid is through your bone marrow sampling. They sample your bone marrow and typhoid will be diagnosed. But because this is cumbersome, most places don't do it unless all other means of confirming are inconclusive. And if you're diagnosed with typhoid, remember, everybody in your family would need to be tested to see whether you have given them typhoid so that they can get treatment. So, in the first week of your illness, your blood can be used to diagnose typhoid. But it's not that wider test that you do in Nigeria or you do everywhere. It's a blood culture. wider test that you do in Nigeria is not, you will hardly be positive in the first week of your illness. But if they take your blood and culture it, send it to the lab to do what we call microscopy and culture, and even sensitivity means they will take your blood, put it in a medium, keep it for a while, use the microscope to see the infection, the bacteria, then find the right antibiotics that will cure it. In the first week, wider tests. So if you go, for example, you have all these symptoms, they do wider tests and it's negative. That does not rule out the fact that you have typhoid, because wider tests that you do may not be positive in the first week. And remember, I will talk more about wider tests. So apart from the blood culture, you can also use your pool and do a culture, especially like in the second week. And this infection may be seen in your poo and diagnosed conclusively. You can also have your urine can be cultured. So a blood, stool, urine culture will diagnose typhoid. But because like in the sub-Saharan Africa, like in Nigeria, because of poverty and lack of equipment, and so what most people do in Nigeria is wider tests. That's what you go to do. Or if they've done wider tests and it has diagnosed typhoid. So what you need to know about this wider test that you do is that, number one, in the first week, it does not show anything because it's not the infection you're seeing. You're looking for the antigens and the antibodies that I talked about last week. Antigens are like the enemy, the antibodies are like, the proteins that the body form to fight the enemies. So with the wider test, they don't see the infection. What we see is the antigens and the antibodies. So the first week, you may have typhoid, but wider test will say, no, you don't. Then, if in the second week of your illness, wider test says you don't, then most likely you don't have typhoid. Your doctor would also have done malaria tests, which we call thick and thin film, to check whether you've got malaria, because malaria can affect the result of the wider test. So your doctor will take your blood for wider test, which is a serological test that just measures antibodies. So we have the O antibodies we call somatic antibodies. We have the H antibodies we call flagellate antibodies. Why the O antibodies measure acute infection, meaning the current infection. The H antibodies are measuring previous infection or even immunization. It's measuring maybe immunization against typhoid. So it does not tell you that you've got typhoid at that point in time. So a one-off typhoid wider test is not very helpful. A one-off typhoid test is not helpful and is not conclusive in the diagnosis of typhoid fever. So the advice normally is, if you did a typhoid test, for example, and the O antigen is over 1/160, that means it's positive for recent acute typhoid. It may mean that. While if the flagellate is over more than 1/60, it will mean that you've had typhoid before or you've had vaccination against typhoid. But because things like malaria can also make this result to be a bit unclear, it is advisable, if you want to use wider tests to diagnose typhoid fever, you would need to repeat the wider test within at least, if you can't do it every day for 3 days consecutively, you have to repeat it within 7 to 14 days to see whether the O, that somatic antigen, is rising. So if it's rising, it tells you that you have typhoid fever. But if it's not rising and it stays there, then you may not have typhoid fever. So a one-off wider test that you do all the time in Nigeria does not diagnose typhoid fever. It does not. It just gives you an idea that you may have typhoid fever, but you need to have further tests to confirm it. If you're not going to be able to do a blood culture, a stool culture, you do that wider test. There's another one we call Typhoid. I'm not sure whether it's available in Nigeria, but they also use it. It's also another serological test to give you an idea whether that bacteria is in the system. Wider test does not see the bacteria. It doesn't see the bacteria. It just sees the antibody that gives the idea that that infection was in your body. So that's the issue that you need to learn today, that a one-off wider test is not diagnostic of typhoid. It may tell you that you don't have typhoid, but it may not tell you that you have typhoid. So that is what you need to know with the blood test you do. Obviously, apart from doing the wider test, I'm sure they always do the full blood count, which the white blood cells will give us an idea what kind of infection you have and But normally, like in the UK where I am, we don't do wider tests for typhoid. When people are suspected of do typhoid, we send their poo for culture, or usually their poo. We don't do wider tests. We do a poo test. And then if the poo test is negative and the person is having symptoms, we go ahead and do blood culture. We can go ahead and do bone marrow sampling if it's necessary, but that's rare. But wider test is not a test we do here for typhoid because it is not a confirmatory test. So that is about diagnosing typhoid with your blood test. Then, after your typhoid has been diagnosed, what is the treatment of typhoid fever? Like I said before, if you did a blood or a stool culture, they will culture and find the infection, look into the microscope and see it, and also test for the antibiotics that would work. But with wider tests, you don't have that luxury. They just say, oh, your somatic antigen, the O is 320, 1/320, you got typhoid fever. So most of the antibiotics that you use commonly, amoxicillin, ampicillin, even augmentin, ciprofloxacin, a lot of them have become very resistant to typhoid because of abuse. So what we recommend as the first line, I'm not saying you should go and buy it yourself, antibiotics like ceftriaxone, azithromycin, these zithromas they're talking about in coronavirus, cefotaxime, all those antibiotics are the antibiotics that are recommended. Do you understand? And then if you have a mild to moderate illness, you can stay at home and take your antibiotics for 1 week to 2 weeks. And it can eradicate the infection. But sometimes it becomes serious when you have persistent vomiting, you're delirious, and all that. You need to be admitted in hospital for you to have these antibiotics through the drip, intravenous. You have drips before you get better. And obviously, if you do have complications like intestinal obstruction or peritonitis, you may have to have operation from your typhoid. You may have to be rushed to the theater for an operation. So if you have other complications like pneumonia, you'll be treated with antibiotics. You have encephalitis, any complication will be treated based on what that complication is in hospital. And most children, when they have typhoid, they're always admitted and treated in hospital. But under mild to moderate, you can stay at home and treat it within 1 week to 2 weeks. You finish your antibiotics, and you normally start getting better in 3 days. Within 3 days, you should start getting better. Symptoms will start resolving. So, this is how to treat typhoid fever. Then that brings us to what we call, okay, let's talk about relapse before we go to other aspects. If anybody who has suffered typhoid fever may have noticed that Some people, after a week of stopping the antibiotics, the symptoms come back. And they're like, what's going on here? So that is what we call relapse. And typhoid fever can relapse a lot. So when you relapse, you will also need to go back and take more antibiotics for a longer length of time. In most of the cases, the relapse is not as bad as the initial one, but it does happen. It's called relapse. Then we need to talk about carriers. Very interesting. We have what we call typhoid carriers. These are people that incubate this infection for more than a year. They may not have symptoms, but they will be passing it on to people through fecal or through sex. So this normally happens when your typhoid was poorly treated or not even treated, because some people can get better, they start feeling better without treatment. So that infection has not cleared. It would go and hibernate in your body, maybe in your gallbladder, and stay there. So you will still be excreting it in your poo, in your urine, and you will be contaminating people. And you will be well, you feel well, but people will be having typhoid fever from you. So normally the advice is that if you do have typhoid fever and you have taken your antibiotics and you're feeling well, you should send your stool sample to the lab for it to be checked to see whether the typhoid has been cleared, the Salmonella typhi is cleared. If it's cleared, fine. But if it's not cleared, you would need to take further treatment, even sometimes up to 28 days of antibiotics for it to clear. Because if you don't treat it, you will become a carrier and you will harbor Salmonella typhi for even a year or more. And it will be there. And you'll be infecting people, but you will not have symptoms. And if somebody has oral sex with you or anal sex, they may catch typhoid fever from you. And then when you poo and don't wash your hand, you will contaminate the person, but you don't have any symptom. These are called chronic carriers, and there are a lot. Even some of them may have to have operation to remove the gallbladder before this stops, before this is resolved. So the carrier is very important. It is something that we must be aware of, that you can incubate and hibernate that infection for a long time, even though you're well. If you have had it before. So it is very common, I think up to 10 to 20% of people who were not properly treated, maybe they give you antibiotics, 3-4 days and you feel well, and you think you're fine. Meanwhile, you're incubating that infection in your gallbladder or in your blood, and you pass it on to people who are innocent. So when we know, you probably have had oral sex, and tomorrow you're ill and you're thinking, what's going on? I mean, not tomorrow. After a couple of days or 1 week or something, you're running a temperature. You wouldn't know that you've gotten typhoid fever from that person. So if it's something else to learn today, you should take that away. If you have ever been diagnosed with typhoid before, you will need to go and do your stool test, not wider test, to check whether that infection has cleared. You must do that. Otherwise, you continue being ill. You continue passing it on. So all these people that when they have small cough, whatever, they say you got typhoid fever. I don't know how they diagnose it for them. People go and do wider tests and they see 1/120 or whatever. They say you got typhoid fever. That's not true. You may not have typhoid fever. It may just be showing you the previous infection, especially the H antigen. You will need to, if you can afford it, after a wider test, and your antigen is more than 160, the somatic antigen, and you're not well, you should ask for another wider test within a week or 2 weeks to see if your titer, that somatic titer, is going up. It's going up from 160 to 320 to 640. But if it's not going up, then you probably don't have it. It's probably malaria that is a problem. So typhoid fever is common, but it's not as common as they talk about it every time, because they're not diagnosing it properly. They are not. Some people have knee pain. They said, "Oh, this your knee pain is due to typhoid." If you vomit for 1 day, they say it's typhoid. I mean, if you have runny nose, they say it's typhoid. For you to have typhoid, you need to have those symptoms. You cannot be suffering from acute typhoid without symptom. Sometimes somebody is just feeling weak. No temperature, no headache, no constipation, no diarrhea, no abdominal pain, no joint pain, no ache. They said you have typhoid. How? Typhoid is an illness, it's a bacterial infection. So when you have acute typhoid fever, you must have symptoms. You must have symptoms. Temperature, headaches, you would. If the doctor, like other temperatures, if you have temperature, your heart rate goes high. But in typhoid, as your temperature is going, your pulse is going down. What we call faggot sign. So that your doctor may notice that on your examination, that your temperature is 40 degrees and your pulse rate is 60. It's unusual. Because normally, as your temperature is going up, your heart rate is going up. So these are the things you need to know about typhoid. Let me see whether there's something I've not touched. I've talked about symptoms, prevention, transmission, relapse, wider tests, carrier, diagnosis. I think I've talked about the basic things. So I will just recap. For the purposes, for the benefit of those that are just joining. Typhoid fever is a bacterial infection, serious bacterial infection that usually affects your intestines. That's why they're called enteric fever. And they're caused by gram-negative bacteria known as Salmonella typhi, which is commoner in places where sanitation and habits are bad. Poverty. It is transmitted through your feces and your wee through foods and your drinks. If you have it, you secrete it in your poo, you secrete it in your urine, more in your poo. And then when your food is contaminated by the poo, even if it's little poo that was in your finger, you will catch typhoid fever. So that is why when you poo, you must wash your hand properly. If you wee, you must wash your hand properly with soap, not just run with water. You may contaminate people with typhoid. Like I said, you can get it from seafood, you can get it from vegetables, and food that obviously when you see the food has stayed too long and is smelling, you shouldn't just eat it, because you're now prone to, catch infections. And if somebody had touched that food with their hand that wasn't washed, you are likely to develop typhoid. And it can occur in children, commoner in them, but milder in them. In adults, it can be mild, a little bit mild, and it can be very severe. It can kill. The complications are many. The bottom line is that it needs to be diagnosed properly. Your symptoms: fever, headache, constipation, aches and pains, cough. When you have those symptoms, think of typhoid fever. It may be malaria, but your doctor must check your malaria and do the test. But I know that since bone marrow sampling, blood culture. Blood culture may take even up to 7 days before the result comes out. Stool culture, obviously, it wouldn't take less than 72 hours. Urine culture, you know. So people resort to doing wider. But let that wider be interpreted properly and let it be repeated again for comparison to see whether the titer is going up. If the titer is not going up, you may not have typhoid. And the only good thing about Widal is that maybe in the second week of your illness, if you do the test and the titer is low, less than 160, all this 120, 1/20, 1/80, that means you don't have typhoid. While Widal can confirm that you don't have typhoid, a one of Widal will not confirm that you have typhoid. It may just be malaria that is affecting the blood result. So that diagnosis is important. The complications are many. Like I said, GIT bleeding, there's bleeding in your gut, perforation of your gut, peritonitis, sepsis, endocarditis, encephalitis, osteomyelitis, osteitis, gallbladder infections, joint infection, bone infections, madness, neuropsychiatric illnesses, pneumonia. These are the things that can happen, and you can die. Blood infection, multi-organs will fail, the liver will fail, the kidney will fail, the spleen will fail, even the heart will fail from typhoid. So it is a serious illness, but it needs to be diagnosed properly and early. And I talked about carrier. It is important. Anybody that has been properly diagnosed with typhoid should go and do a stool test to check whether the infection has been eradicated from their body. Because if the infection hasn't been eradicated from your body, you may be a carrier. You're just carrying it and you're not having symptoms, but you're passing it on to your sex partner or your family people. And if you have been diagnosed with typhoid, please, all your family people will need to be tested to see whether they are carriers or whether they've got infection. All right? So, and I talked about the vaccination, which could be a one-off injection, which could be 3 capsules you take alternate day, and they give you protection for up to 7 years. So they're all there for you, So I thought to talk about typhoid because of how common it is and how it's been misdiagnosed in Nigeria and how it's poorly treated. Don't just go to the chemist and buy amoxicillin and take for 3-4 days. All those antibiotics have developed resistance, most of them. So you need to take things like Zithromas, ceftriaxone and things like that before most likely your infection can be cleared. All this going to the chemist and buying amoxicillin, augmentin, it may just be poor treatment. It's not clearing it properly. And your treatment, you may have to take treatment even at home for up to 2 weeks of taking those antibiotics for it to be properly eradicated. And the only way to know that you've been cured is taking that test, 2 tests, after your symptoms have gone. Okay? So let me see whether there are questions. Whether there are questions to answer. Usually, I don't know what happens to this thing. So let me see whether there's something to answer. Where do I start from? My God. Comments are plenty. Let me see whether there are questions about this typhoid. Usually I don't see most of the questions. It's when I have dropped I will see the questions. So I just hope we learn something, even if it's 1 or 2 things, about this or typhoid. If at least we're more aware of the illness. The symptoms are so similar to malaria, so it is difficult to just look at somebody based on what their symptoms are and you say, oh no, this is typhoid. It is not possible. It is not possible. You know, the only way typhoid can be differentiated from all these other conditions that look like it is by tests. You know, we can manage widal in Nigeria because obviously we can't afford to do. Yeah. Yes, for last year, paratyphoid is also another enteric fever, and it's milder. So let me see. Yes, typhoid is common in children, even though it's milder. And yes, the Chimandeo. So, yes, Chidima, yes, poor sanitation and poverty are contributory factors to typhoid, obviously, because people are not washing their hands, and it's not only in coronavirus that you have to wash your hands. You know, if as soon as you go to wee or poo, it is important that you wash your hands with soap immediately. I mean, before you touch food or drinks, or before you put your finger in anybody's mouth. You know. Yeah. So it looks like they're just repeating what I said. Thank you, Evangelist. I have not seen Sylvia. Okay, Doctor recap. I think I have recapped. You know, so no questions. You know, no questions. Yes, for last year, the yes contracted through contamination of food, poor hygiene, correct. You know, and it can be got through anal and oral sex if the person is a carrier. You cannot get typhoid from the air. It's not a droplet infection. It's not an aerosol infection. It's basically a fecal oral feces to the mouth. Even you can get it from your wee as well. So Evelyn, I don't know when you joined. Yes, can be sexually transmitted in that way, not vaginal sex, oral or anal, if the person is incubating the infection. Hey baby, how late comer? I haven't seen any question or the question hiding somewhere before they will say, oh, you didn't injection and you have capsules, which are tablets. Thank you, Messi. So the symptoms you're having, success. If these are the symptoms you're having, you should go and since you're not going to be able to, I don't know whether you're going to afford to do a stool culture and a blood culture, since you had it for a while. If not, I mean, if you had it for a while, why that test is neither here nor there, unless you're going to be able to do a series of it and check the titers and see whether they're rising, and then see what the flagellate titer says as well. You know, God no go shame us. No. How God go shame us now? Precious, thank you. I'm not seeing any question. I don't know. At the end now, I'll hear, for yes, you can have intestinal perforation, which can lead to peritonitis, sepsis, and multi-organ failure, and you could die. The person could die, or and it's life-threatening. So, yeah. Is it true that the best way to detect, the best, surest way to detect typhoid is through bone marrow sampling? But it's complicated. But you also have the blood culture, stool culture, even urine culture. These are the the investigations that if you do, they would see the typhoid, the salmonella typhi, in the microscope after culturing it. Unlike in wider, where you don't see anything, you just see you just check the antibodies and see, it's like, oh, this, like a visitor. Have you had this visitor? And then it will show you that you had the visitor. Yes, multi-organ failure. Yes, it's serious. It's serious. Can malaria lead to typhoid? Favor, you can ask very, very interesting question. Malaria, oh God. I said before, typhoid is a bacterial infection caused by a kind of bacteria, gram-negative bacteria that we call salmonella. Malaria is caused by a protozoa. It's a different kind of, it's not caused by bacteria, it's caused by a parasite called Plasmodium. So, malaria cannot cause typhoid. Malaria is a different kind of infection, but the symptoms, they look like the symptoms of typhoid. Malaria is caused by Plasmodium, be it Plasmodium vivax, falciparum, ovale. It's a kind of that obviously is passed through the female Anopheles mosquito. So malaria is through mosquito bites, while typhoid is through food and drink contamination. So they're not, even though the symptoms mimic each other, they are not related in any way. Hello, Anita. I wave at you. Imabong. Yes, bone marrow sampling is the surest way to confirm typhoid. Yes. I haven't seen any other question. Thank you. Yes, Ebube, if you do have typhoid, if you have been diagnosed with typhoid, your entire family would need to be tested for typhoid. Typhoid fever, yes, is a very, very contagious disease. Obviously, it's very contagious. It's not through air, like coronavirus. It's not through coughing. It's through mouth. Fecal oral. Poo to mouth. Wee to mouth. Apart from that, sexual slave. So the infection must enter your mouth for you to have it. It must enter. You must eat it. Yes, lack of equipment. Yes, fellowship is true. In the UK, nobody does wider tests for typhoid. Nobody does that. Yes, in the first week of your illness, wider test is usually negative. So if you become ill that first week, maybe you got contaminated, then you start having symptoms in the week, then you go for wider test and it's negative, oh my God, I don't have typhoid. That's not true. That is not true because usually it's negative on that first week. So you have to go back in the second week of your illness to do a typhoid wider test. And then if it's negative, then you can say, okay, yes, I haven't got typhoid. Like I said, wider test is more, there are a lot of false positive and false negative, but it's more reliable in ruling out typhoid. As in, if the antigen is telling you that, okay, we have had this infection in your blood. So if it's all negative, then the infection wasn't in your blood. Where the problem is using wider tests to diagnose a recent acute infection. Yes? Yes. I'm looking for questions. These guys are making me laugh. Somebody is spamming the live stream. Oh my God, Nigerians. Man, that's the thing, though. In fact, anytime you have little fever, you go to the doctor. Oh, you've got typhoid fever. I've never seen anybody who had temperature in Nigeria who they didn't tell had typhoid fever. Everybody has typhoid fever. Everybody has malaria. Even if it's ordinary flu, nobody has flu in Nigeria. Nobody has temperature due to dehydration or anything else. It must be typhoid. It must be typhoid. But that is not true. That's the problem. Love Ndubisi, yes. You repeat the test and compare it with the first one and see whether the titer is rising. If it's not rising, then it's unlikely to be an acute infection. Love Ndubisi, yes, you got me right. The one-off wider test is not diagnostic of typhoid. It may rule out typhoid, but it is not a reliable diagnosis of typhoid. No. Thank you, Ebube. Yes, bone marrow sampling is a very painful and tedious procedure. So I don't think anybody will want to do it in Nigeria, to be honest. Nagwe, thank you. Jennifer, I don't know when you joined. Do you know whether you're late? Yes, Favor, all this time they are telling you have typhoid every time. Nope. Go and have a stool culture. Take your poo and tell them to culture it, because obviously, by now it should be your poo if you have typhoid. Since all that number of months, go and do your stool culture and see. Forget about white down. Tell them to have a look at your poo and see whether there are salmonella typhi in it. Yeah. Today we didn't. If you are, I'm colleague too. Please. Oh. Thank you, Alezi. Yes, typhoid carriers, they incubate it and they may not have symptoms. They won't have symptoms, but they will be passing it on to people. Very wicked. And anybody can be a carrier if you are not properly treated. So if you have had typhoid before, go and do a stool test and see whether the infection is still there. And that will diagnose the carrier status. And it can be like that for a year or more. And you just be there spreading the thing, Yeah. Yeah. Yes, loving the BC, you just reiterated what I said. So if you're a carrier and your diagnosis is a carrier, you can be treated with antibiotics for up to 28 days. And if that didn't work, and you may need to have a cholecystectomy, removal of your gallbladder, for you to be cured. Yes, it's as bad as that. With the carriers, they may not show symptom at all. At all. They'll just stay there, they carry the infection, they work out. Yes, love the BC. You need to do a stool test to check if the typhoid is cleared. Correct. Ebere, Adadne. Okay, your first time of watching. Boss lady. Yes, you can have aches and pains with typhoid. You can also have complications in your bones. So, typhoid don't be small thing, though. Oh, Arsenal is playing football today. Yes, yes, you now know symptoms to look out for in typhoid fever. You cannot have typhoid fever and be well. And they will say, in terms of you're suffering from typhoid now. A doctor is diagnosing typhoid. Meanwhile, you don't have symptoms, or maybe you just had runny nose or had one. If you have an acute typhoid infection, you'll be ill, no matter how mild it is. So there's a football going on now. Grace, okay, if you've been dealing with it for years, what you would do is to go back to your doctor or go to the lab and ask them to do a stool microscopy, culture, and at least microscopy and culture. Don't do wider tests. Don't do wider tests. I mean, if you do wider tests, you can also look at the H antigen and see what's the level, you know. But if you do a stool test, the stool test will be able to tell you whether you have the infection. So it's not just yes, for the malaria does have similar symptoms with typhoid fever. It is not possible to see a patient. I mean, no doctor can, with certainty diagnose typhoid fever without investigation based on your symptoms. Even if with the fagged sign that your pulse is low with your temperature high, it may still be neither here nor there. The doctor must have to do investigations before they can confirm that you have typhoid fever. Uduman, nice to have you here. I didn't know. I think people who are not on the foundation can still watch. It's true. So, can you go to hospital and ask to be vaccinated? I don't know which hospital in Nigeria, but even in the UK here, you pay for it. It's part of. It's not a routine vaccination. It's a travel vaccination. So a lot of private hospitals in Nigeria, when I was in Nigeria, had it. So I don't know, but at least the injection, the vaccine, the injectable one, I'm sure, but I'm not sure of the capsule. It may be there, So I think everybody who is prone to typhoid should go and get vaccinated. I don't believe that the vaccination should cost a lot of money. Okay. Adiko, yes? Kenneth, you keep asking me to repeat these drugs. It looks like you want to rush to the chemist and say, give me Zithromax or give me ceftriaxone or cefotaxime and things like that. Don't go. Confirm that you've got typhoid first before you jump into treatment. Yes, can it make someone not to poo-poo? Yes, constipation is one of the symptoms of typhoid. Even though you may end up having diarrhea at some point, but diarrhea is not common. Constipation is more of a symptom of typhoid. So you wouldn't go to toilet. That's what constipation is. Either your poo, you don't go, or your poo is very hard, but Yeah, Chukdi, thank you. Leo, I don't understand what you mean with the carriers. They don't show the symptom, but if you do the test, they would show the infection will show in the poo or in the urine. It will show there. Thank you, Betsy. Chinemerem, you said you've been getting my head keep hitting me. That you mean headache? If you do have headache on its own, without temperature, constipation, aches and pain, cough, loss of appetite, if it's just headache on its own, it's unlikely to be typhoid. It is not impossible, but it's unlikely to be typhoid. Like you probably know, there are several causes of headache, which you can't even, I can't enumerate here. It could be your vision, it could be stress, it could be anxiety, it could be a side effect of even medication, it could be too much rest, it could be due to malaria, it could be due to typhoid, it may be due to cancer, it may be due to encephalitis. The things that cause headache are too many. It could be migraine, it could be cluster headache, it could be sex, what we call postcoital headache. Some people have headache after sex, so causes of headache are too many. So I can't tell you whether your headache is due to typhoid. But typhoid can cause headache, but it should be associated with other symptoms, not just the headache. No. Grace, if you do have symptoms of typhoid, then that's not the time to go for vaccination. You do not you don't take vaccination when you are having the illness. So when the illness is completely eradicated, treated with antibiotics, and you're not a carrier, you're not incubating anything, you may wish to take, after a while, you may wish to take prevention for further attacks, because unlike viral infections, many viral infections, typhoid fever does not give you immunity against it next time. So you can suffer it today and suffer it next year. Unlike maybe if you do have chicken pox, you probably not have it again for life, or things like that. That's not how typhoid fever operates. Animal reservoir. No, typhoid fever is a human disease. It is not an animal disease. It doesn't occur in animals. So there are no animal reservoirs for typhoid. It's a human disease alone. Love. Bridget, after taking malaria drugs, you took the malaria drugs. Taking malaria drugs does not mean you had malaria. So if you're having symptoms of malaria, be it like temperature, bitter mouth, headaches, aching joints, and loss of appetite or whatever you're having, you can take the anti-malarial, and if it doesn't, the symptoms don't go, then I'm afraid you would have to undergo investigations to know what is causing your symptoms. You may need to see a doctor to direct you towards the kind of investigations you need to do that would diagnose what is causing it. So I'm not sure, what's wrong with you now. It could be, yeah. Thank you. So it doesn't look as if, I'm sure when I drop now, I will see a lot of questions that I didn't see. Yeah, I'll finish today at 9:30. So Marco, what is the wahala? Blessing, Ubuonye. If your just head is hitting and pounding alone, is it stress headache? Is it migraine? Is it cluster headache? Are you dehydrated? Is there a side effect of medication you're taking? It is not possible for me to tell you why your head is hitting right now. But headache is one of the symptoms of typhoid. But you're unlikely to just have headache if you have typhoid fever. Just headache on its own. No. Yes, we have a low turnout today. I don't know why. Maybe I don't know whether it's a sports, or maybe people are not interested in typhoid, or maybe because there was not enough sensitization. Leo, it is not. You cannot transfer. I don't believe you can transfer pass typhoid from mother. It's not something that passes through the placenta, or you can have a vertical transmission on typhoid. No. Typhoid isn't hereditary. There is no bacterial infection that is hereditary. It has nothing to do with hereditary. It is an infection, bacterial infection. Imabong, how are you? Yeah, good to see you. I don't know how you joined this. I thought this was only showing on the foundation page. Well, Chinedu, you have not answered my question. I hope it's the one you asked whether typhoid can cause constipation. I don't know. I said yes, it can cause constipation. Oh my God, Mickey, you're very funny. You make me laugh. You feel like having typhoid because of the way I'm explaining it. It's not a walk in the park. It is not a walk in the park, my friend. You know, it's not a walk in the park. You know. No, Falashida, I don't know about next topic. Diamond, good evening. No, you don't go to any lab technician and ask them for bone marrow sampling before they wipe out your bone marrow. Please. It's an investigation that a doctor will have to send about. I mean, you have to go through a proper physician before you can go to that level. Please don't go to a lab technician and say, I want bone marrow sampling before the person will wound you. Don't even try it. Yes, every stomach pain in Nigeria is typhoid. I know. Meanwhile, the things that can cause abdominal pain are legion. Where do you even start? To talk about the causes of abdominal pain. But anybody that has abdominal pain in Nigeria, whether it's gastritis or diverticulitis or cholecystitis or whatever it is, they say is typhoid. Unfortunately, that is the way things are in Nigeria. Yeah. Thank you. Yeah. Mr. Oswald, my friend. I know, Mickey, it's crazy. They just tell you you've got typhoid automatically and they give you augmentin and say go and take. Oh, God. It's heartbreaking. It's heartbreaking. But, you know, Amanda, yes, I said typhoid, if can be passed through oral and anal sex, if the person is a carrier. Obviously, now with oral sex, the person is excreting the bacteria in their poo and their anal area, and then if your hand touches the poo and you put it in your mouth, the same thing with oral sex, the same thing with anal sex. You know how it goes. So that's why it's not vaginal sex because you can't get it from vaginal sex. It's anal and oral. Thank you, Chinwe. Anita, yeah, I've had time to do it every week, every Saturday for the last 4 weeks. Talked about depression, mental health illnesses, and suicide. I've talked about sickle cell genotypes and all that. Talked about blood groups and resource ISO immunization. And today I'm talking about typhoid fever. So I will find out if I would be able to talk about anything else next week. Bibian, welcome. Once Oswald, I'm not able to tell you what is a complete cure. It is a disease that I think you need a physician, a doctor to guide you because I don't want drug abuse because there's already a lot of resistance against the common antibiotics because of the misuse. If you're not using the right medication or you're not taking the right dose or you're taking it for a shorter time than you should or you're taking it indiscriminately, you're bound to develop resistance against those antibiotics. So if you go buying Zithromax or ceftriaxone and all those things, and be asking people to administer willy-nilly, chances are that you may develop resistance against it. So, no. Ngo Ifi said, what are the symptoms of typhoid? I don't know whether you've heard it when I said it, but if you are just joining, I would quickly tell you the main symptoms of typhoid are high temperature, which could go up to 39, 40 degrees, constipation, cough, aches and pain. Then you may develop other symptoms like loss of appetite, abdominal pain, confusion, delirium, You may develop a rash on your chest, on your abdomen, you know, which we call root rest. You may develop complications, you know, and those complications could give you some symptoms, like if you do have bleeding, you may become tired, you may vomit blood, pass black stool, you know, feel so weak, and there are many. All these people talking about us now. Are people still watching match? Vin, there was no time I said I was a native doctor. This is why you're asking me whether it can be treated with local herbs. I wouldn't know that. Yeah. No. Frank, you need the typhoid vaccine. No, go look for it. I don't know where to recommend. You know, I don't know. I don't sell it. I'm not sure, Chinedu Amaluchuku, the questions, I'm not seeing them, to be honest. I will upload you. I don't, let me keep going up and see whether I will see the questions you asked me. This guy is so fun. This Mickey, okay, you're a very funny guy. Eudora, how do you know you're a carrier? You cannot know you're a carrier unless you do the stool test. You cannot look at yourself and say, I'm a carrier. So they need to do a stool test for you to see whether you're incubating it. You know. Lillian Casca, thank you. Okay, would the doctor conduct a test? The normal thing to do is, if you have typhoid, for if you have been diagnosed with typhoid and you are given a treatment, after the treatment, you need to do a stool test to confirm whether it's all eradicated. That's the only way to know whether it's all eradicated, whether you are no longer you're not a carrier. If you don't do that, you will not know. All right? There's no complaint. If you're a carrier, you don't have symptoms. You may not have symptoms. Yeah, I've seen. Okay, let me see what you asked. Headache, that's Chinedu. Headache, stomach is not just in order. Fever can boil water. Having cold when covered, you start feeling, I feel like vomiting. Yes. Should it be typhoid? It could be typhoid. Like I said, there is no way to use symptoms alone to diagnose, because these things you told me now, headache, stomach is not in order, fever, can boil water, cold, may also be malaria, maybe even urinary tract infection. You know, the upper one we call pyelonephritis. So there is no way to know whether it's typhoid. I can't tell you that it's typhoid. It could be, not should. It could be. Can oversleeping cause typhoid? Absolutely no. Typhoid is a fecal-oral infection. It has nothing to do with sleep. Faith. Sleeping does not cause infection. Thank you. If Monica, does typhoid cause severe headache? Yes, typhoid can cause the severe headache and dizziness. It can cause it. It is a possible cause of that. I'm not saying that if anybody that has headache and is dizzy has got typhoid. It could be stroke, it could be cancer, it could be anything, it could be anything. So it could be migraine that you're having for your severe headache, and it could be cluster headache, it could be anything. But it is possible in typhoid. I hope you understand what I mean. Yeah. Yes, no, taking the vaccine on its own does not afford you 100% protection. So even when you've taken the vaccine, personal hygiene is important, as well as ensuring that you eat well cooked food, warm them, don't wash your hands after pooing. Yes, Iwuji, you're absolutely right. The vaccine does not give you 100%. You know, you don't go take vaccine and then go and stick your hand in infected poo and put it in your mouth. You know, I cannot talk about ulcer today, I'm afraid. I'm sorry. That's a different kettle of fish. Good night, Bridget. So let me see. Blessing Amazu said, is it true that having constant headache can lead to high blood pressure? No. It's the other way around. High blood pressure can cause constant headache. Headache does not cause high blood pressure. But one of the symptoms of high blood pressure may be headache. Okay. We see. Stay blessed. Lucy, thank you. So, no. Eudora, coughing out of blood is not a symptom of typhoid, unless you obviously have a very serious pneumonitis. You know, so coughing off of blood is what we call hemoptysis. You know, but vomiting of blood, which we call hematemesis, it would happen when you are bleeding internally, especially in the upper part of your gastrointestinal tract. So that can happen as a complication of typhoid. Hemoptysis is more unlikely. It's more unlikely, which is coughing off of blood. You will have that in things like if you have tuberculosis, you have pneumonia, you have lung cancer, you have pulmonary embolism, you have serious chest infections like that, cancer. So if you're coughing out blood, you must go and see your doctor quickly. It is a serious problem. It may be a serious problem. Sorry. Yeah. Yes, Falashi, they say some typhoid treatment can work on some UTI, urinary tract infection. Yes, of course. Yeah, yeah. I mean, you treat your urinary tract infection with antibiotics. So those antibiotics that work in typhoid fever most of them can work in UTI. Yes, of course. Most of them. Basically, like in a woman like you, if it's ordinary uncomplicated urinary tract infection, things like trimethoprim would be fine, nitrofurantoin, will be fine. But those things probably will not treat typhoid these days. Amoxicillin, some people use augmentin, which is called amoxiclav, cephalaxin, things like that. They could work on typhoid as well. So it's definitely, yeah. Why are you not happy? Is anybody that wants to? It's not compulsory to learn. I like this. I like this, Mickey. I like your sense of humor. Yeah. Don't moan about people who didn't come on board tonight to learn about typhoid. Maybe it's not important to them, or maybe they have more important things to do today, or maybe they're having problems with their network, or they don't have credit on their phone. There are several reasons, so I don't think you should bemoan them. There may be several reasons why they are not logging on today. So I will be leaving the scene shortly. If there are no more questions to ask, at least I believe that everybody who isn't a doctor here would have left with just at least one thing or the other that is new to them that would help them in the way they manage their problems, this typhoid issue going forward. Okay, thank you guys. I'm going to call it a day. Bless you.